We all get gastric upsets following sudden changes in eating habits or when going on a holiday, and it settles down spontaneously with no medication. Some express the situation as just gastric. Food poisoning is quite common today, with people patronizing their favorite restaurants frequently. The common bugs you contaminate in non-home cooked foods are cyclosporiasis, an infection caused by the parasite Cyclospora satanensis. If you get bloated or having pain and rebound constipation with diarrheal episodes the day after enjoying food in a restaurant, you need to visit your GP for a stool culture. Gastritis is a general term for a group of conditions that start with inflammation of the inner lining of the stomach. It could be acute, lasting a few days, recurrent and chronic in certain situations. The inner lining of the stomach is quite strong, much stronger than your skin. The night acid juice is pure hydrochloric acid the parietal cells in your stomach lining produces. 20 to 100 mils has a pH of about 1.5 to 3.5. If such acid juice touches your skin, will burn the skin. It is strong enough to dissolve metal, but the same acid juice secreted in the night in your stomach lining caused no problems. What a marvelous situation! Mucus secreted in mucus glands in the stomach seem to prevent any inflammation or gastric erosions. The night acid juice is waiting for food at breakfast to be neutralized. That is why it is called breaking the fast. If you skip your breakfast, it is most likely that the acid juice can cause gastritis. So do not skip your breakfast any day. This acid barrier in the stomach prevents growth of certain bacteria and facilitates denaturation of dietary proteins as they enter the stomach. The acid seems to help digestion of food we eat. The inner lining of the stomach is lined by a mucous membrane referred to as the gastric mucosa. The cells in this lining are tall epithelial cells that secrete mucus that protects from irritants and the acid juice the parietal glands produce. This tough inner lining has small pores called gastric pits containing exocrine cells that secrete digestive enzymes like pepsin, which break down dietary proteins, and hydrochloric acid into the hollow region of the stomach. The gastric acid causes no problems so long as the acid remains within the stomach to perform its functions. If acid refluxes back into the lower gullet or esophagus due to a weak valve system at the esophageal-stomach junction called the cardia, cause inflammation of the lower gut. This gives rise to a burning sensation behind the heart region of the chest in the chest cavity and is referred to as a heartburn. It is also called gastroesophageal reflux disease or GERD, G-E-R-D. In some situations, the acid can erupt as far as the throat, causing burping, coughing, and a sore throat. When the gastritis is acute, it may settle down spontaneously with rest and no medication. But if you get recurrent, frequent bouts of stomach upsets, you need to check up what is causing the problem. Those people who use long-term certain medications like aspirin and ibuprofen will get inflammation of the inner lining of the stomach. Excessive frequent alcohol consumption can cause an alcoholic gastritis. Certain chronic illnesses such as diabetes or kidney failure can cause gastritis and stomach upsets. A weakened immune system can cause gastritis. Gastric mucosa holds the body's largest population of immune cells. Lymphocytes called T cells are in abundance in the lining. These cells increase during the Helicobacter pylori infection of the distal stomach, causing ulcers. There is the type A gastritis caused by immune system destroying stomach cells due to some autoimmune disease. In such a situation, it can increase your risk of certain vitamin deficiencies, anemia, and cancer. Another cause for chronic gastritis is Helicobacter pylori bacteria, which causes stomach ulcers. Chronic gastritis can be caused by chemical irritants like non-steroid anti-inflammatory drugs, alcohol, or bile. One problem with chronic gastritis is, in addition to thinning the inner lining due to inflammation, it can cause stomach lining erosions to produce gastric ulcers and bleeding. Persistent stress increases acid chews, and that may cause gastritis. Chronic recurrent gastritis from any cause needs treatment, as long-term gastritis can wear away and thin the inner lining to reduce its functions. You could get chronic gastritis due to a blood disease called Pernicious anemia. This is an autoimmune disease due to the functional failure of the gastric parietal cells that secrete acid juice. In this condition, vitamin B12 level in your blood becomes low. This condition is produced due to the body's inability to absorb vitamin B12 required to produce blood cells. Pernicious anemia occurs in individuals above the age of 60. The name pernicious was given as there was no cure for this disease previously. However, this condition is treated today by giving vitamin B12 as supplements. In this condition, the gastric mucosa is thinned out and referred to as atrophic gastritis. When the gastric lining is thinned out, it does not produce adequate amounts of intrinsic factor protein to absorb vitamin B12. Another cause of acute gastritis is due to the Helicobacter pylori bacteria. The bacteria cause the inflammation of gastric inner lining and settles down in a day or two. When it becomes chronic, the gastric mucosa swells and causes erosion of the lining. Irritable bowel syndrome, or IBS as we call it. One could suffer from chronic gastritis. It causes symptoms like stomach cramps, bloating, diarrhea, and constipation. It is a lifelong problem when you get it. To ease bloating, cramps, and passing gas, eating oats or porridge for breakfast is a good idea. Avoid foods that are hard to digest like cabbage, broccoli, cauliflower, Brussels sprouts, beans, onions, and dried fruits. Avoid products containing sweeteners like sorbitol. Do cook at home using fresh ingredients when you can. Keep a diary of what you eat and any symptoms you get. Drink plenty of water to prevent dehydration. Get plenty of exercise and try probiotics daily. There are certain don'ts when you have IBS. Do not delay or skip meals. Do not eat too quickly. Do not eat lots of fatty, spicy or processed foods. Do not eat more than 3 portions of fresh fruits a day. A portion is about 80 grams. Do not drink more than 3 cups of tea or coffee a day. Do not drink lots of alcohol or fizzy drinks. Cut down on high fiber foods like whole grain foods such as brown bread and brown rice, nuts and seeds. Coronavirus can cause symptoms related to gastrointestinal tract, and gastritis seems to be a factor. The study authors noted that the first US patient admitted to a hospital with confirmed coronavirus had a loose bowel movement on hospital day 2, Labs in China have been able to isolate the live coronavirus from stools of patients, the study authors said. These factors brought the gastrointestinal tract to the forefront of investigative minds and suggest that clinicians should identify patients with gastrointestinal symptoms and carefully monitor those patients. Listeria bacteria induces gastritis with pus formation. Hence it is called suppurative gastritis. It is a harmful bacterium that can be found in your fridge in ready-to-eat foods like meat, poultry, seafood, and dairy. It is found in unpastured raw milk and dairy products. Soft cheese made with unpasteurized milk such as queso, fresco, feta, brie, raw fruits and vegetables such as sprouts, ready-to-eat deli meats and hot dogs. Refrigerated bakes or meat spreads, refrigerated smoked seafood. Listeria is found in the soil and it can contaminate vegetables. Animals can carry the bacterium without appearing ill and can contaminate foods of animal origin such as meat and dairy products. This bacterium can cause food poisoning. Do not keep boiled rice in your fridge for more than 3 days. It is a good nidus for the Listeria bacteria. Bile reflux gastritis. Bile is an irritant to the stomach lining. Lifestyle changes are required to ease the condition. Stop smoking. Eat smaller meals. Stay upright after eating. Limit fatty foods. Avoid problem foods and beverages. Limit or avoid alcohol. Lose excess weight. Raise your bed. The bottom line is gastritis can be caused due to various reasons. The early symptoms for all forms of gastritis are similar. If your stomach upset does not subside within a day or two, you need to see your doctor. Hope this video was useful. Keep well and goodbye for now.